Hi, a very good morning to all of you and a very happy Mother's Day from Team Nova Southend Fertility and IVF New Delhi. We welcome you all. I am Dr. Vandana Bhatia and we welcome you all for our online webinar series related on various aspects of fertility. We all know that COVID-19 pandemic has affected our social, economic, and health systems across the world. Lockdowns were imposed last year, causing abrupt closure of fertility services, leading to interruption of ongoing cycles and the delayed start of the new ones. People were dejected and they were very anxious. But gradually, as the new guidelines came up, as the new recommendations came up, and as there were lockdown the relaxations, there was a steady resurgence of ART services following protocols, strategies, and following a high standard of clinical care, minimizing the exposure risk to both the patients and the ART staff. And just as when we were seeing a little ray of hope, there has come a second wave and a new phase of pandemic, which is much, much more devastating. COVID-19, as you all know, is a new virus disease. Knowledge about the cause, the short-term effects, the long-term effects are all limited, but data is fast accumulating. The mutants of this virus are changing. And with this, there is a change in the risk of infection. There is change in the severity of the complications, the morbidity, and the mortality rates. But the good part is that there is a successful development of vaccinations at a very fast pace. And this has given a new ray of hope for all of us to contain this pandemic. Massive vaccination drives are going across all the countries. Though vaccines are not foolproof protection to the disease, but still they reduce the severity and the complications associated with it. With the development of new vaccines in such a short span of time, there are concerns, there are reluctancies, there are hesitancies among certain group of populations in all the countries. And it is absolutely normal to have these kind of concerns, but we must not forget that confusions, myths, falsehoods also sprout up during these trying and difficult times. One common group of people who have been reluctant to use these vaccines is those of pregnant females and those patients who are waiting to become pregnant either spontaneously or by means of ART treatments. And we are also well aware that there is very limited data regarding the COVID-19 vaccination and fertility issues right now at present to make a universal kind of recommendation. But we need to answer the queries, the questions, and the concerns that our patients have with whatever data is available to us. And to answer these questions and concerns and provide accurate evidence-based information, we have with us today Dr. Sonia Malik, who is the Program Director, Nova Southend Fertility and IVF New Delhi. Ma'am is one of the pioneers in infertility with more than 40 years of experience. And she has headed various professional organizations, has many awards, publications, authorships, presentations, both national and international to her credit. I welcome you on board, ma'am.
Thank you, Vandana. Thank you for this wonderful introduction to the subject. And first of all, let me also wish everybody who is here with us today a very, very happy Mother's Day. We hope that we will be able to make more people mothers in the coming year, despite this horrible pandemic. With that, let me also now start with whatever Vandana has in store for us, because this is a very pertinent and very, topical subject at the moment. All of us are very distressed with the various types of queries and questions that we have regarding the vaccination. And as Vandana has rightly pointed out, we have two groups of patients coming to us. One, of course, the ones who are trying to get pregnant and the ones who are already pregnant. And we have to actually address the concerns of both of them in order to give them adequate protection and make them safe. So yes, Vandana, let's go ahead.
So, ma'am, we all agree that pandemic has affected the ART services to all our patients. But there are two aspects. One is the pandemic itself, and one is the COVID-19 infection. So, how are the patients affected by these two different aspects?
So if you're talking about the anxieties, the mental status of the patients, we know that it is universally hit everybody. I mean, whether it is a patient or a doctor like you or me, we are all anxious and we are all in kind of mental distress as far as the pandemic is concerned. But if you're talking about the fertility, how it is affecting the fertility of our patients, well, like you rightly said, one part is that of the pandemic, and the second part is the disease itself. So we have to address. So basically, the pandemic is affecting the fertility, as the WHO statistics are also pointing out now. After a year of the pandemic, they are seeing a decline of about 4% in the fertility rate world across. And the reasons for this are because basically the availability of the hospitals and the services, as well as the economic slowdown and difficulties that the patients are facing because of the lockdown, the social conditions, all that is taking a toll on the fertility rate of the patients. But when you talk of the virus itself and when you talk of the disease itself, that doesn't seem to be affecting the fertility of the patients at all. I mean, in the sense that there are no studies to report that it has an adverse effect on the gametes, and there are no studies to say that the fetal outcome as a result of the pandemic is worse. I mean, in terms of fetal malformations, there are pregnancy complications, but as far as malformations and effect on the baby or the fetus is concerned, there are hardly any seen. So therefore, we can safely say that these viruses are actually not affecting the fertility per se, but yes, they do seem to be affecting the fertility rate because of various other reasons. But on the other side, we also have a group of patients who are sitting at home and those who did not find any time to be with themselves. And those are the ones now who are benefiting from this because they have got the best chance of their lifetime to be together. And therefore, we find that in those particular patients, there has been a slight jump in the fertility, and we find spontaneous. But you also see in our own clinic, you have seen that we have had many spontaneous pregnancies in patients who are coming to us for fertility treatment. So there is always a downside and an upside to everything. And this is what is happening to this pandemic as well.
So I think that is a very important message for all the patients who are waiting for their infertility treatment and ART procedures, that they can relax, or the patients who've had COVID-19 infection, that this infection has not hit their fertility status as such, right? So ma'am, with so many vaccines coming up and everything, so do you think that is it a concern that these vaccines which are being produced against the disease will cause any change in the infertility or will cause a decline in the infertility? Yes.
So again, yeah, that is a very big myth that is going around. People are very concerned that the vaccines themselves may not cause a problem with the fertility, and it may decrease the fertility. But again, the technology is such, none of the technology that has been used for the various vaccines, whether it is the Pfizer or whether it is Covishield or Covaxin, none of these are actually responsible for anything happening to the reproductive system. It does not affect the reproductive, they don't affect the reproductive system, they don't affect the fertility. There have been reports of decreased sperm counts found in the COVID disease, but not after the vaccination, only after the disease. So, and that also, that is very temporary. After some time, the sperm count returns to normal. And therefore, that is not a very big concern also. But as far as vaccines are concerned, till date, we haven't had any reports to say that it affects the fertility of the patient. So rest assured, if patients are going to take any kind of vaccine, it's not going to affect their fertility. It's not.
And the same goes in for pregnancy as well?
Yes, pregnancy, again, there have been complications. See, we have to very well understand that today these vaccines, why we are talking about these vaccines, you very rightly said that the second wave that we've had is very, very deadly. It is not like the first wave. It is producing much more morbidity and mortality amongst the patients. And therefore, we are wanting our patients to be covered by vaccination, number one. And the second thing is that the availability of vaccine is now much more than what it was earlier. In the first wave, we didn't have any vaccines. Now we have vaccines. So therefore, it is important for us to promote the use of vaccines and not feel scared that it is going to hit our fertility rate at all, because it doesn't. But then at the same time, what you're saying is, you said that, what was the question that you asked just now, Vandana? What did you say?
The vaccines, even in pregnancy, even
In pregnancy, yes. In pregnancy, there are reports that in the first trimester, there can be miscarriages. But again, the miscarriage rate is very low. It's not as if, sometimes there is a spontaneous miscarriage in pregnancy as such. And that may be attributed to the vaccine. Therefore, there is a little bit of a dichotomy of thought over there. And so people are advising, many countries are advising not to take the vaccine in the first trimester because of this confusion that this abortion or miscarriage may be caused by the vaccine and not, it wouldn't have happened itself. We all know that there is a high rate of spontaneous miscarriages in patients who are trying for a pregnancy. Second thing is that in the second and the third trimester, where we are now very scared, where the virus is causing a lot of problem in pregnancy, there is a high risk of preterm labor, and there is a high risk of preeclampsia. That means hypertension during pregnancy. So these are the two, and of course, thromboembolic phenomena, which it is known for. That is what the disease is. So therefore, respiratory complications because of thrombosis and preterm labor and preeclampsia, these are the complications that our patients are getting into. And therefore, in order to protect them, in order to have a safe pregnancy, it is advisable to take vaccines. And we are going to talk more about this and when we should be taking it, how we should be taking, and which ones. That is what we need to understand.
correct. And so that means the carry home message would be that you would recommend that everyone should get vaccinated.
Yes,
Is that
yes,
right?
yes, yes, yes.
Okay. Now, as far as the vaccinations are concerned, people are concerned whether there are, now we know that you have made it clear that it does not have any impact on the fertility as such. But apart from that, are there any other side effects or potential risks or harmful effects of getting vaccinated?
Yes. So you know that any vaccine that has been developed so far, whether it is the flu vaccine, which is given in pregnancy to everybody now, or whether it is the typhoid vaccine, which is not given, I know, but then we have the vaccine, and then we have the hepatitis vaccine, which is in so many doses, not given in pregnancy, but otherwise. So all of these vaccines do produce side effects. They all lead to fever, chills, malaise, things like that. And that is exactly what is happening to this vaccine. Flu vaccine causes the same in pregnancy. And that is exactly what is happening with this vaccine. So the minor side effects are fever, body aches, malaise, and of course, maybe dizziness. But of course, there are reports with the Covishield, which our viewers would also be very concerned about, that there are reports to say that in 1 in million, it's very, very small, minuscule, but yes, it can lead to thromboembolic phenomena. That means thrombosis can happen in some of these women. This is with the Covishield or the Oxford-Zeneca vaccine. And the second vaccine, again, is the Johnson's vaccine, which also is known to produce that in younger patients, not in the older patients. So, but Johnson is not yet available in India. We only are talking about Covishield and Covaxin because these are the two which are present in our country. And therefore, that is the reason that the government has yet not cleared these vaccines for use in pregnancy. Because basically we are not sure of what are the, like you said, these vaccines have been produced very hurriedly. And therefore, there are very few trials on these vaccines, and there's hardly any trial in pregnant women because pregnant women and lactating women were not included in any of the trials. Yet now, because of the retrospective data that is coming out from various countries, we are finding that it is theoretical to consider all these problems. They are actually not happening practically. Practically, these vaccines are seemingly safe, and they are actually protecting and sort of causing a dampening of the disease in all the patients. So therefore, most of us are now inclined to give these vaccinations to women in order to protect them. Therefore, but of course, hardcore data is still awaited. We don't have it. So that is one catch, and that is what we have to make our patients understand also. Yeah.
And ma'am, we have seen with these vaccinations and jabs, we have seen that different responses occur. As you said, few people do get fever, few people feel a stinging sensation and a heaviness in their arms. But there are persons who don't just feel anything, nothing happens to them. And their concern is, oh, whether their immune system is really working or not. So not having any kind of these side effects in the form of even milder ones, fever, chills, malaise, does that mean that the vaccine is still protective? Or does that mean that the vaccine is not working? That is a very common query that so many of our patients are having and asking us.
Absolutely. I can understand that concern because, basically when you're just absolutely fine. You feel, ki, Arey, mujhe to kuch hua hi nahi, is it effective or not? But you can also, again, extrapolate the same thing to the other vaccines. Many a times, even with the flu vaccine, you don't get any symptoms, you get nothing, and yet you're protected and your baby is protected. Similarly, with the other vaccines as well, you don't get any, some people get it and some people don't get it. That doesn't mean that your immune system is not working. Everybody's immune system behaves differently. And everybody has an immune system. That is very important to understand. And the reaction that the immune system has to anything is very different for different individuals. And I would say as Indians, because we have so much of immunogenic food in our traditional food even. For instance, haldi. Everybody is talking about turmeric, haldi wala doodh pi lo, haldi wala. That's a tradition. So therefore, most of us have this modification in our immune systems. And hence, who knows which patient is taking more of such foods, who knows which patient is not taking enough. So it depends on what your own body type is. And therefore, you react the same way. And so your reaction to this vaccine also, and so your reaction to the disease also. So that is what we are finding. And hence, I would say, please do not think that the vaccine is not acting. It acts. It definitely will produce antibodies, but you may not feel the thrust, or you may not feel the side effects of it. But definitely it is producing antibodies. It's not that it won't, it will. It is effective. Yeah.
So the next most important question: if a female partner gets vaccinated, should she delay her plans of conceiving either spontaneously, or what if she's waiting for an ART treatment, whether it is an IUI or an IVF or an FET, frozen embryo transfer? Should she delay her plans? And if she has to delay her plans, then what is the timeline that she's looking at? Because so many patients are waiting, and this second wave has created a total, havoc in their lives, and the logistics have changed, everything has changed. So this is one question that we are bombarded with, and everybody wants to know an answer to this.
So basically, now the advice is, all of us as such, in the country, as well as, although there are no guidelines issued. Foxy has issued a guideline recommending vaccination of pregnant women, but like I said earlier also, the government has yet not cleared it. So we are not going to talk about pregnancy vaccination. Let us just talk about a woman who wants to plan her pregnancy and whether she should be vaccinated or not. She should be vaccinated. And how long should she delay her treatment? About, how much do you quarantine a patient? 2 weeks. And then after that, she's free to, do whatever work she is. She's COVID free, she's everything free. So the similar thing probably will hold true for a vaccination as well. You can wait for 2 weeks and then restart your treatment immediately. Just see that your symptoms subside. You don't have any fever, you don't have any side effects, and then you start with the stimulation. That should not be done, because basically that will interfere with the treatment. So let that settle down, and then you can restart your treatment. So there's no point in waiting for many months. However, having said that, Covishield, we know we have to take 2 doses. So whatever is the schedule, suppose you have to take 2 doses and you have to wait for 4 weeks or 6 weeks, as is recommended to you, you can start your treatment even then and take your second dose while you're on the treatment. That has also been recommended by many of the governments and many of the societies. The Canadian Society is recommending that, and so also the British Society is recommending that. So, but of course, like I said, we don't have any guidelines in the country as such for our vaccines. But having said that, because we now know that these vaccines are safe, so therefore you can start, and then you can take your second one while you're at it, but before you get pregnant. because like I said, it has not been cleared for pregnancy. So see that you complete your course before you are pregnant, and then you can go ahead safely. I'm sure in the coming months, or in the coming days rather, we may be having a clearance from the government also, depending upon whatever data we've got from the country. I'm sure we'll be able to clear them, because many of the countries are looking at it like that. So therefore, as of now, the ART patients, the ones who are waiting for their infertility treatment, can surely go ahead and get themselves vaccinated, wait for 2 weeks, and then restart with their treatment. In case they want to go in for their second dose, they can get their second dose also, and then come back to us, or in between start their treatment, take their second dose and go ahead with it. Both ways it is possible.
And does that hold true for the male partner as well? If the male partner has been vaccinated, does this timeline goes in for the male partner as well?
Absolutely the same. Absolutely the same. We both of them, we recommend the because see, Vandana, if the patient gets COVID in between while we are doing the treatment, then it is a bigger problem. So
Correct.
therefore, we want them to be vaccinated before we start the treatment.
Correct. And ma'am, does this waiting timeline, because few people were recommending 4 to 6 weeks, 6 to 8 weeks also. So for this kind of a timeline, does that hold good for all these subjects, especially the elderly patients, who are 40, 38, 41, who are waiting for the ART treatment, or even the younger ones who have a poor ovarian reserve and some immediate action needs to be taken. And especially they have been waiting last year and they were planning to have their ART treatment this year, and now with this all vaccination and everything confusion. So can't can't we give them a choice of, in such a scenario, particularly for this subset, can it be done that they can collect their eggs, freeze them, and transfer them in the next cycle?
Yes, of course. See, again, all these patients, you all know that when we did the first phase, first wave came, we also opened up in a staggering manner. First of all, we started with doing, we were offering services only to the cancer patients, or the ones, like you said, poor ovarian reserve, the patients who cannot wait, and
Correct.
also the elderly couples who have very little time left. So basically, we had opened up for them initially. And now again, in the second wave, we are saying that okay, get yourself vaccinated and come immediately. There's really no need to wait. There is a difference in looking at what is happening to the body of the woman if she gets COVID or if she's vaccinated. There is a difference in that. If she's vaccinated, it's not going to affect her body at all. I mean, there is no risk to the fertility. If there is COVID, then yes, because of the thrombogenic effects and because of the inflammation that there is in the body, we will have to wait for all that to settle down before we start treatment. Hence, again, depending upon the severity of the disease, if the patient is asymptomatic, she has really no symptoms at all, and she is COVID positive, well, she can wait for 2 weeks, let all her symptoms subside, everything can come back to normal, and then she can be asked to come back, say, after a month, isn't it? Because 15 days she has to quarantine, and we make her wait for a couple of days to see that everything settles down. On the other hand, if there is a patient who's gone through a moderate disease or a severe disease, you cannot ask her to start and resume treatment in 2 weeks or 3 weeks. You will have to wait for at least 2 3 months for all her inflammation to settle down, for all her markers to come back to normal. Let her stop with all the medication that has been prescribed to her. And once she's absolutely normal, then you can start with her fertility treatment. So I suppose we'll have to look at COVID now with a different view, depending upon the severity of the disease. So COVID patients will have to wait for a longer period probably because of the disease, and the vaccinated patients do not have to wait longer, because for them we are only trying to produce antibodies, and that has got no risk to her body, and so she can be treated immediately, or maybe after 15-20 days, like we do for anybody.
So that means it has to be individualized.
It has to be individualized.
Can't take
Yes,
uniform
yes.
timeline for all.
Definitely. Timelines. Yes, yes.
So if a patient has already got a COVID-19 infection, should she and her partner still get vaccinated before embarking on a pregnancy, or they can go in for an ART treatment first and then go for a vaccination? What would be your take on it?
Definitely they should get vaccinated. That is for sure. Now, what about the timeline? Whether we should do the ART first or whether we should do the vaccination first is something that needs to be considered. Now, if the patient is having very mild disease, like I said, then she is fit for vaccination immediately, isn't it? Then she can go in for a vaccination whenever there is a call. So the other question is, when is she going to be called for the vaccination? No, when is it going to be her turn? So basically, 28 days between the two doses is sometimes in asymptomatic patients. However, if the patient has had a major disease, then they say that at least 2 weeks after the complete resolution of the symptoms, and if yeah, and suppose the patient has been very sick, then at least 1 month after the resolution of the symptoms. So therefore, for them again, it is going to take a longer time before they resume any kind of whether it is a vaccination or ART. They'll have to wait longer. But if the patient is asymptomatic, she can easily go in after 15 days for her vaccination, and then that is the recommendation from the Indian people, the virologists and all, and so for the Indian vaccine. So that is how they are spacing it.
And if you become pregnant, if the patient becomes pregnant after receiving the first dose of the vaccine, should she delay getting her second dose of vaccine?
Like I said, there is no contraindication to it. Because basically it has been advised to take it in any of the trimesters. So she can go ahead and finish her schedule the way it has been suggested to her. However, since we are not sure of Covishield, there we may say that, okay, you can stagger it to 8 weeks, because in any case, we are saying there should be a difference of 6 to 8 weeks between the two doses. So presuming that she's had the first one just when she became pregnant, she can stagger it towards the end of the first trimester and then take the second dose, to make it a little more safe for her. That's it.
So the myths that were associated with the vaccine, that it causes a damage to the placenta and everything, do not stand the way they are, and they are all myths, and patients should not be afraid of that.
That's true. That is completely a myth. That doesn't affect the placenta. There is also a story going around on the internet saying that these vaccines are developed from dead fetuses. That's also a myth. It's not from dead fetuses. We know that the virus is the carrier is an adenovirus, and it has not been extracted from fetuses. So therefore, all kinds of stories are going around, but they should not be believed. No.
And what about the third-party reproduction, ma'am? The sperm and the egg donors, should they also be vaccinated?
Ideally, yes. Ideally, after all, they are also human beings. So all of us have to, and of course, the safety of the cycle would be that she does not get COVID when she's being stimulated. So therefore, we need to cover them as well with the vaccine so that they are safe, and we don't have cancellations of cycles because the donor got a COVID positive.
Correct.
So therefore, all of them need to be vaccinated before we begin with them.
Correct. In spite of all the reassurances and whatever we may tell our patients, few patients are still hesitant. And their question is, if I don't get vaccinated, what are the risks of contracting COVID-19 during pregnancy? I'm sure it's a very difficult one to answer, but still they would want to hear this because they're still reluctant to, take the vaccine in spite of whatever we may say.
I think even though, yes, you're right, there has been a lot of reluctance, even amongst the doctors and healthcare workers, but because of the fear of the side effects and all. But now this second wave has told us much more. It has actually proven to us that the vaccines are working. They may not be 100% efficacious in preventing the disease. You may still get the disease, but it definitely alters the course of the disease and definitely dampens the effect of the whole infection. I'm an example myself. I have had bad COVID a couple of days ago, and I'm a person. I'm old, and I have so many comorbidities, and with that, there was a modification in the disease, I feel, which has brought me back. And I'm here in front of you. So I feel it was worth it taking the vaccinations. And I would suggest it to everybody so that, at least it changes the course of your disease and maybe makes it a little better for all of you. I would suggest, yes, it should be taken. The second wave has definitely taught us this, definitely.
Correct. There are people, ma'am, and before the guidelines, before this was issued, everything, there were people, pregnant people, females who have got vaccinated. Now, their question is that will their baby be automatically immunized against this?
There are mixed reports on that. Very few reports are saying that there is a immunity effect on the baby as well. It is immune. Many of the babies have had, actually they have been testing them for the inflammatory markers, in fact, IL-6 and CRP, etc., and they have found them high in some of the babies, but they return to normal within 24 to 48 hours. That's what the reports are saying, and they are not at all causing any problem to the baby. But majority of the reports are not indicating that it causes an immunity in the baby as well. The vaccine primarily today is being given to protect the mother and to actually safeguard the mothers against the side effects of the disease, the problems of the disease, not side effects, I would say the complications of the disease. So basically our aim is to protect the mother, not the baby yet. Maybe as the studies go on and as we get more and more data on it, we may be a little more wiser to say whether it is also giving some kind of a protection to the babies.
Correct. So another thing is, ma'am, that even after getting vaccinated, fully vaccinated, so many patients have had their vaccination. Is there? They are still, they are anxious because of the second wave, which has been very devastating. Now their query is, what if I get COVID-19 even after full vaccination? Then where do they stand? Can they get it? Number one, they want to know this, whether they can still get COVID-19 after full vaccination also.
They can. It doesn't protect 100% against getting the disease, like I said. The efficacy of our Indian vaccines is just about 67 to 73%. It's not 100%. But like I said, yes, it alters the disease. It is definitely altering the disease. So if somebody is to have a mild disease, she may easily pass off as asymptomatic because of the immune status. And another patient who may be, having would have had a severe disease otherwise would end up having a moderate or a mild disease. That's why we are saying that it should be given to all patients who are trying for a pregnancy. Yeah.
Ma'am, with the coming of this COVID and everything, and with strict guidelines in place, the recommendations, and as we people are also doing doing an RT-PCR for the couple before starting the treatment and during the day of pickup, during the day of trigger also, repeat RT-PCR, and if it is positive, we cancel the cycle. Now, this was all that we were following the strict guidelines. No, and the patients were a little apprehensive. They were a little scared. What if my PCR comes out to be positive on the day of trigger? The whole cycle gets cancelled.
Yeah.
Yes. So there were dejections also, we know. Now, the question is that if they get vaccinated, will these same standard operating protocols still be followed, or they can get away with it without getting the RT-PCR done on the day of trigger or before the start of the cycle? Because many patients come and say, "Arey, hame to ho chuka, ma'am. अब नहीं होगा, हमारी सारी फैमिली को हो चुका है, हमने वैक्सीनेशन भी करा ली, अब क्यों करवा रहे हो RT-PCR?"
Yeah, very, very valid. If I were in their place, I would also feel the same. Kyun karwa rahe ho? But again, you all know that there is a risk of reinfection happening in everybody. The ICMR definition for reinfection is a positive test between two negative tests at an interval of 102 days. This was the definition.
Repeat, ma'am, repeat.
A positive test between two negative tests at an interval of 102 days. That means 3 months or 3.5 months. If you have a positive again, then it is a reinfection. So that is the definition that ICMR had given in the 2020. I do not know what the definition is going to be now with this second wave. We do not know how quickly this second wave is going to cause reinfection. We don't know. But from the data of healthcare workers who are getting reinfected very, very easily, not the patient so much, rather the healthcare workers who are inside the wards all the time, they are getting reinfected in a span of 2 or 3 months, 3 months basically. So we are looking at that happening to everybody, not just the healthcare worker. And therefore, all these strict guidelines will still have to be followed, even though, of course, if a patient has come back after asymptomatic COVID just about a month ago and we have started her treatment, seeing that everything is normal, there is a very, very low likelihood of her getting another infection so soon. It won't happen. But suppose it is 3 or 4 months, or in the first phase she had it. Now she's also vaccinated, agreed. She can still get it because the vaccination is also not 100% surety against it. Therefore, whenever we are doing our treatment, for the safety of the patient and for the safety of all of us, we need to definitely keep on maintaining the same standard, the same kind of protocols, and triaging our patients accordingly, the way we have been doing all along. Because otherwise, anytime we can end up, having a problem in any of our patients.
So this
Yes.
conveys a very, very important message to all our patients across, that RT-PCR for COVID in the coming days or maybe in coming
Going to
months
stay.
and years, it
Yes.
will be integrated as a part and parcel of the pre-IVF testing, no matter whether
Absolutely.
the patient has got the infection or the patient has been vaccinated.
Absolutely. And even when we start the treatment, Vandana, after she's positive, COVID, we will definitely see that she's RT-PCR negative before we start the treatment, isn't it?
Correct, correct.
That is how we are going to start in any case. So therefore, whatever it is, like you're saying, it is going to be like a hepatitis B or a hepatitis C test, which we are doing pre-IVF to see that this patient is safe and she doesn't have COVID.
Yes. And the other important message is that even if they are vaccinated, even if they have got the COVID-19 infection, still
Yeah,
standard operating protocols, still the universal protections and the preventive measures have to be taken by
absolutely.
the clinics, by the patients, by the couples while they are undergoing the treatment, while or not even in their normal life also, they need to take all these precautions.
So we have to continue wearing the mask. We have to continue doing social distances. We
Correct.
have to keep on sterilizing and disinfecting ourselves as we have always been doing. All that needs to be maintained because we do not have a definite treatment yet for the disease. We are only talking of prevention. And prevention at the level earlier, it was only by these measures. Now we have an added vaccination to it, which may enhance the protection a little bit. But again, like we say, not 100%, not 100%. But therefore, we all have to maintain all those standards, keep on doing what we have been doing, and in addition, get ourselves vaccinated.
Correct. So, ma'am, thank you so much for all these queries. And I welcome if any patient who has joined us has any queries, they can put us up on this panel and we will discuss it. What is your final carry home message for all the people listening?
Well, I think we've discussed it threadbare now. We have actually very clearly pointed out to our patients, the ones who are planning pregnancies, that they should first get vaccinated and then start planning, because if they get pregnant in between, it might cause a problem. To the patients who are already pregnant and they wonder whether they should get vaccinated or not, our this thing suggestion is that you wait for the government guidelines. We cannot tell you to get yourself vaccinated yet, although it has been strongly recommended by most societies, even Foxy. But we cannot ask you to do it to get yourself vaccinated yet, because the government has yet not issued any guideline on that, and ICMR is also quiet on it. So till we get any further instructions from the government on the pregnancy patients, our advice to you is isolate, stay inside. Don't let yourself get exposed to this disease, because the second wave is definitely much more severe and it causes a more serious disease. Therefore, all those of you who are pregnant and logged in with us today, be very careful, stay inside, stay isolated. You'll have to maintain this all through your pregnancy in order to remain safe till we get a directive from the government that we can vaccinate you. That is what I can say to you. Yeah.
And what about the patients whose cycles have, what message do you have for them? The patients whose cycles, unfortunately, has been, they are asymptomatic totally, but the RT-PCR has come up to be positive on the day of trigger and their cycles have been cancelled. What, they are devastated, they are dejected. But what message do you have for them? And they are looking to come back soon. So what?
Of course, we are also waiting to have them back with us soon, because there is no point in, we have to lead a life, Vandana, despite the fact that we are faced with this terrible disease. We are trying to make life as normal as possible for all of us. And therefore, these patients, like I said, the asymptomatic and the mild disease patients can get back to us faster. Uh, Vaccination, yes, if they are waiting for their vaccination, they can get themselves vaccinated and come back, or they can even come back to us after, say, 15-20 days of being negative. We can start the treatment, and when they receive a call for their vaccination, they can get themselves vaccinated in between and then continue with their treatment with us as well. The only catch is that they should not be having symptoms of fever, etc., while we are doing the stimulations, because that is going to interfere with our with the whole treatment. So wait for all that to settle down, and then we can start with it. We can start with treatment. There is the earlier thought of these patients waiting for 4 weeks or 6 weeks is no longer valid. We are not asking patients to wait for 45 days or 6 weeks or 2 months, because the reports have shown that there is no point in doing all that in these patients. They should be treated like any other patients who are doing their normal work also after the isolation period is over. So also for these patients.
And another one last question, ma'am. Uh, what about the patients who've had their pickup done, specially, not the ET, the pickup done, and they have frozen their eggs? What,
Embryo.
frozen their embryos.
Yeah.
So what recommendation, any kind of, though there is no recommendation, but still, what advice would you like to give them, that after how many days of the procedure that they should get themselves vaccinated, just to avoid, any kind of side effects like fever, which then may be attributed towards to the procedure?
So after the pickup has been done, and they are waiting during that 1 month, or say they generally, patients give a gap of 1 month before they come for a frozen embryo transfer. So during that period, they can make use of that period and take a vaccine. It is absolutely indicated, even while they are going through the frozen embryo transfer cycle. Patients, the British Fertility Society has advised patients to take it even during that period. But since our vaccine is different, it's not the same as the Pfizer vaccine. Therefore, I say that, we can tell them to do it during the interim period, before they are trying for before the embryo is put back, because at that time again there is a possibility that they may become pregnant. And today we don't have any recommendations for pregnancy in India, no. So therefore, that interim period between after the pickup, once everything has settled down, again we must remember, whenever we are doing pickups, it is again a thrombogenic situation where we are causing a problem with the circulatory system, and therefore, once all that subsides, they can take their vaccination and come back to us for an embryo transfer after everything is over.
So that
a
means,
gap of 1 month or 2 months, and then come for an embryo transfer.
yes. So that means that after the pickup, after the ovarian stimulation, and then the pickup, they should wait for at least 7-8 days to settle down.
Absolutely, for everything to settle down. Yes.
For a vaccination.
Yes. Maybe even, suppose she's a PCO, suppose she's got huge ovaries, you will ask her to wait longer, because she is more prone to hyperstimulation, and she has a tendency to have a problem. So therefore, you will ask her to wait longer for the ovaries to settle down and become normal, and only then take a vaccination, not before that. So patient to patient, it will be variable. And of course, we want to see that everything has normalized. Then only subject them to a vaccination and call them back for an embryo transfer.
Correct. Thank you so much, ma'am, for answering.
Thank you, Vandana. Those are very interesting questions, and I think pertinent too. Yeah.
Yes. I hope we have been able to answer most of the queries that our patients had during our teleconsults and video consults. But if they have still more queries, they are most welcome to post them to us. I think we are having this thing.
You must be I'm unable to see them, but you must be seeing them.
I am not being able to see the message. Oh, this is pertaining, somebody has asked you about the donor eggs IVF treatment, the success ratio. This has not to do anything with
Okay, yeah.
the COVID vaccine at present.
Mhm.
Right. So thank you so much, ma'am, for
Thanks, Vandana. Thank you. It was a very enjoyable. I hope our viewers have found it such, and I hope we have done justice to it. Thank you very much. Thank you so much.
Thank you, Team Nova Southend. Thank you so much.
Thank you. Thank you.